Welcome, everyone. My name is Pam Lovett, and I have the great privilege of serving as board chair for the Rose. The Rose is most fortunate to have a strong, committed board, talented staff, and an amazing array of supporters like all of you. Thank you to everyone who was able to join the call today. We appreciate your investment of time, talent, and treasure to support the critical mission of the Rose. Happy New Year! Lest you think that the pandemic has totally impacted my ability to keep track of the days, the Rose ended a successful but challenging fiscal year on July 31st, and we wanted to start the new year with a chance to thank each of you and to provide an update on the state of the Rose. We're so excited to be building on 35 years of success. Though it's impossible to adequately thank each of you for your myriad contributions, we do want to acknowledge three special individuals. We are most grateful to each of you for every volunteer hour, every dollar that you've contributed, and your willingness to share your reasons for supporting the Rose with your broad array of friends, coworkers, and friends. The three individuals who we want to highlight today with special recognition, they ensured the tremendous success of this year's annual luncheon. Because of their amazing efforts, even though the pandemic necessitated canceling our in-person gathering, the Rose is able to provide the highest quality of breast health care to both insured and uninsured women. Nancy Craig and her all-star host committee worked tirelessly. Thank you from the bottom of our hearts to Luncheon Chair Nancy Craig. Though we weren't able to celebrate our amazing honorees in person, we do offer deepest gratitude to Frances Arnold and Jackie Ogilvie. Frances and Jackie are well known for their wonderful volunteer impact and their grateful breast cancer survivor attitudes. Among our amazing long list of supporters, we wanted to use this platform to especially acknowledge Nancy, Frances, and Jackie. Thank you, thank you, thank you. We're going to spend the next few minutes hearing from our CEO, one of our patient navigators, and our lead radiologist to give you a glimpse into what makes the Rose different and special. Now it is with great joy that I turn the program over to a woman who needs no introduction, our founding CEO, and someone I am pleased to call a dear friend, Dorothy Gibbons.
Thank you, Pam. And we are the ones that are fortunate to have such a strong and engaged board, especially Pam, and I'm so grateful for their vision right now. You know, the Rose's fiscal year runs from August to July. So during this past fiscal year, we were able to see both a pre-COVID and a mid-COVID time. And that's the uniqueness of this last year. Pre-COVID, we were on track to serve 40,000 women. 10,000 of those women would have been uninsured. We were also anxiously awaiting our third mobile coach, and we were just about to start a brand new program that was going to help our patients find their own physician. Then COVID entered, and like everyone else, our world was turned upside down. Even though biopsies and diagnostic procedures are considered essential services, it was the worldwide shortage of protective equipment that really made us have to close our doors in March. We lost almost $3 million in revenue during that time, as well as the most important thing was we were not able to serve over 3,000 women. Nothing in this world has prepared us for anything like the pandemic. You know, none of us knew what it was going to take on our souls, on our physical, on our mental beings. And none of us had any idea that it would last this long. But one thing I do know is the Rose is not giving up. We reopened our doors in May, and we immediately began seeing patients. We had biopsies and diagnostic procedures prioritized. And then our coaches went out. And this is such an incredible time for us because we are doing just as many patients as we possibly can as social distancing allows. I am convinced that our donors are the #1 reason that we were able to reopen. It is because of our foundations, our individuals, corporations all stepped up to help. And I'm convinced that because of that help, the Rose is going to make it through this pandemic and on to the other side. Our amazing staff is the other reason that we really got through this time. And I can't say enough about them. They are working long hours. They are working 6 days a week. They are trying to get in every patient we can. And this is the same staff that agreed to take a reduction in pay so that we would offset our losses and the Rose could stay strong. They are the heart of the Rose, and I so appreciate them, each and every one of them. We're also so grateful for our insured clients who help us take care of our uninsured patients. They are so important to being part of the total patient population that we serve. The same is true for our community partners, our community clinics, and our physicians who have helped us get the mobile back on the road and help us serve those who most need us. This last fiscal year, we diagnosed 328 women. Half of those women were uninsured. One of the women that we diagnosed was one of our treasured employees. She was only 40 years old, and explaining to her 8-year-old daughter what was going on was by far her toughest thing to do. Our youngest patient was the 22-year-old daughter of a good friend of mine. Now, both these women are doing well. Both these women are strong and resilient, and they have the rest of their lives ahead of them. But a diagnosis of breast cancer is never easy. And during this time of COVID, treatment has been very challenging for all of our patients. It's just a different time to have to be doing this. At the Rose, we know breast cancer inside and out. We know what it takes to get through it. We know all of the struggles along the way. And we also know that the Rose is going to have to stay strong amid all of this chaos. Our programs are needed now more than ever, and we have to be ready to serve. So your support, your prayers, they have sustained us through this past year, and now that allows us to look at 2021 with abundant faith and renewed resolve and great hope. So thank you for not giving up on the Rose. Now, one of our very special programs, and probably the most important program we have, is our Patient Navigation. Today with us is Maria Linares, who came to us as an uninsured woman and who needed our services. She is one of 3 patient navigators who have the privilege of helping our uninsured women get into treatment once we've diagnosed them. You know, when Maria came to us, she was like the majority of our uninsured women. She was working, she'd been at a company for 12 years, but they just didn't carry insurance. Once she saw what happened for her treatment during patient navigation services, she decided that was what she wanted to do. And so she went back to school, did her 160 hours at the Houston community, and since then has gone on to get her bachelor's degree, graduating cum laude. Having a degree was always a childhood dream of hers, and I am so proud of her for getting this done during this time that she's been with us. Maria is a 10-year survivor now. She has accompanied hundreds of women through treatment. She's been in their shoes, and she knows what it means to be there. I have no doubt that Maria will continue to make the world a better place.
Hi, I'm excited to tell you a little bit about what Patient Navigation does here at the Rose. We continue to see our patients in a face-to-face consult, and I think it's important that we do that. We're in the room with the doctor as he or she is telling the patient of their breast cancer diagnosis. And this is so important because when the patient hears the word breast cancer, they are overwhelmed by fear. And then they start asking the questions, how am I going to pay for this? I have no insurance. What's going to happen to my kids? Can I continue to work? And that's when our job starts. That's when we start triaging the patient to figure out what resources, what information they may need throughout their cancer journey. First of all, they need a program that's going to help pay for the treatment. And basically, there is just three. We have the state, we have the county, and if they do not qualify for either one of these, then their last option is the charity program through Methodist Hospital. We begin the paperwork immediately. All the application is filled out, and then we move on to education. We try to educate them on the three modalities of breast cancer and the proper treatments for each one. What is chemotherapy? What is radiation? What is surgery? So we try to get rid of that shock value for them. So when they hear it in the doctor's office, they kind of have an idea as to what all that means. We do tell them that it's important to kind of empower yourself and ask the doctors those questions. So if you don't understand what's going on, you need to ask the doctor so he can explain it to you. We make sure that the patients are kind of educated when they go in there, but also there's other things that may come up, so it's important to ask those questions. Then we move on to support. Do they have friends or family in the area that could help them, to take care of them when they need that other assistance? Or are they members of a church? Do they want support group information? Because it's important to have your emotional state taken care of as well. The doctors will take care of the physical part, but they need that extra help with the emotional because everything is all tied together. So we try to treat the patient as a whole. We talk about the children as well. Do they need to talk to a counselor? If they want to bring them to us, to the office, we can help educate them as to what's going to happen. Because once the patient has been diagnosed with breast cancer, yes, she is going through the treatment, but the whole family is going to go through it with her as well. So it's important to have everyone educated, the children to understand what's happening. We tell the parent to talk to the student counselor, to the counselor office at school, to the teacher, to the principal. That way everybody is watching the children as well, and the parent feels more at ease because she knows our children are going to be taken care of as well. We also discuss finances. We talk about different programs that could possibly pay a light bill or a gas bill, because if that's taken care of, then that frees up money for something else. So we try to help them to think outside the box, and that also relieves some of that anxiety about having to pay bills. We keep calling them. Once they get approved for whatever program they get approved for, we will do all the paperwork for them. We do the referral. They do not have to worry about finding an oncologist, finding the surgeon. We take care of that. We do the referral. All they have to do is answer the phone to get ready for their appointment. So they are very happy about that, because I know that's one big fear of theirs, and we tell them it doesn't matter if you're in Harris County, Shelby County, Jefferson County. We're trying to find a doctor close to home so they don't have to worry about those. They may have transportation issues, so they don't have to worry about that. So we take care of that part, and they're very grateful for that. I think because we do follow up with them, and we do call them every so often. How are you doing? Are you doing your medications that you're supposed to? We always tell them that we're going to be that nosy mother-in-law that's going to be calling them. Are you taking your pills like the way you're supposed to? But in all fun, it does help open up that relationship and help that trust, which we carry on with them and with our navigators and with the treatment facilities. So it helps smooth process with the service coordination, and I think that's very important. It's been so successful that we have people from MD Anderson and Methodist calling and having their navigators to come and shadow us to see how it is that we do and how we do it. We even have the state sometimes refer patients directly to us, because they know once they come in through the doors of the Rose, they are going to be taken care of from beginning to end throughout their cancer journey. And we even have patients sometimes, compliment us and tell us that we are their angels. But really, here at the Rose, we are our family. We all work together, our coworkers, our volunteers, our donors. All of you are our angels to help us pay it forward. Thank you.
And now I'd like to introduce you to Dr. Claudia Cotes, who is our lead interpreting physician. Dr. Cotes is such an amazing physician, and she is also a great, great leader. She was the one that helped us to attain our Breast Imaging Center of Excellence in 2017, and she's continued to provide the guidance and the oversight that every excellent center of breast care needs. Born in Colombia to parents who were both physicians, Dr. Cotes learned very early on the importance of medical expertise in a community that doesn't have all the resources that it might need. She is able to speak to so many of our patients in their own language. She understands the importance of helping them to understand what's going on with them, and she carries her own voice of authority and yet with great hope. So I'd like to have her join us now. I'm so pleased to introduce Dr. Cotes.
I am Dr. Claudia Cotes, and I'm the lead radiologist at the Rose. 2020 has been a challenging year. It has not only threatened human lives all over the world, but also has changed our lives and daily routines in innumerable ways. Now, more than ever, we understand the importance of being healthy, both physically and mentally, in order to thrive. And that is not something easy to accomplish during these times. However, we still have many decisions under our control that we must not forget or delay, such as routine screening exams. We have noted that in the United States, the amount of patients visiting their doctors for routine checkups has markedly reduced compared to previous years. And this, unfortunately, is going to result in misdiagnosis and treatments. In the field of breast imaging alone, it worries me that the continuous delay of screening mammograms will result in a higher number of breast cancers detected later and diagnosed at advanced stages, which is going to compromise the prognosis for these patients. As the time passes, we continue to learn more about the current situation, and at the Rose, we have established precautions to ensure our patients and our staff feel as safe as possible when they visit our facilities. Thanks to the efforts of our employees, our doctors, our donors, and more importantly, our patients, we're able to continue to serve many women regardless of their ability to pay. We're true to our mission, which is that no woman has to die because she has no access to a mammogram. As a physician, I am proud and thankful to be able to provide high-quality care and serve these people who need me the most. And I am grateful for those who care and share the mission of the Rose with us. We can see the consequences of the COVID-19 pandemic in our community. Many patients have lost their health insurance, which means that our impact can be and needs to be stronger in order to be able to provide care for them. This is why I want to encourage our patients to continue their routine screening mammograms. I encourage anyone who is listening to this message to gather the women in your lives and tell them that their health is important and that their screening mammogram can save their lives. You may be saving their lives by doing so. I've seen it many times with my patients, and it's the reason I do what I do. We want to safely be able to see more patients because we know they are the ones who need us the most. We have adapted and continue to adapt to the changes at the Rose. Today, it involves a pandemic, but we have adapted to situations in the past, and I am sure more obstacles await in the future. These changes force us to be more efficient, to remain focused in our mission, and to continue to deliver high-quality care despite the situations we are facing. Breast cancer will not wait for all these obstacles to pass. So make sure you're proactive. Your mammogram could be saving your life.
hope you're as excited as I am about the prospects for the Rose, the impact that we've made, the lives that we touched, the progress and that you all are able to help us achieve. Thank you for taking time out to hear about the Rose's successes, challenges, and the various elements that make the Rose a center for breast health excellence. We know that it's going to be a great year. And now it's my pleasure to virtually introduce you to our 2021 Luncheon Chair, Candace Dodson Epley. Candace and her committee are already mobilizing for a fabulous annual luncheon on March 24th. Thank you, Candace, and everyone who's going to join you in making this a fabulous event. On October 10th, you can join us in honoring with Honorary Chair Elaine Domick for our 31st annual shrimp boil. It's been re-envisioned as a drive-through event. Elaine, we appreciate you. And to all of you who've joined us today, and to the amazing staff, our fellow board members, we are so grateful that you care, that you invest time, talent, and treasure to make a difference. Thank you for joining us today, and know that we're most grateful for your support, your impact, and advocacy. Thank you so much. Have a great rest of the week.